So Rash, of course it's a good thing to upgrade all these 11 hospitals to specialist hospitals.
Yeah.
But this is just a tip of an iceberg. What else are we looking? What are the bigger problems that we are facing here?
Well, here the first thing that comes to mind is that our disease burden has shifted to lifestyle diseases. And that's where our, for example, diabetes. The incidence of diabetes. We are the highest in Asia. And we also have got to look at how these facilities are spread around the country. So we need to also look at the needs of the people who are outside of the west coast of the peninsula, because it's a very good thing that these 11 hospitals are being upgraded. But as you said, we need this is an indication that there's a lot more that needs to be done.
So we are talking about more curative treatment, right? I think government is not doing enough in terms of preventive healthcare treatment. Is the government doing anything on this?
Yes, certainly. I would say the government is doing quite a bit, but we have reached a stage in our development where people have to take more responsibility for their own health. And I think the health ministry has been making this, putting this message out. But overall, there is there's so much more that needs to be done in terms of allocation of resources, and it's a huge subject by itself.
Now, Rash, we talked about cronyism in all kind of sectors, right? Now, when we look at healthcare sector, we are facing the same problem, cronyism. We see contracts of building hospitals being inflated, and then supplies as well. Getting medicines is more difficult and more expensive. So how are we going to solve this issue?
Well, this change of government actually provides us with a very good opportunity to review the situation which has been with us for decades. And we need to really get our act together this time, because the health of the nation depends on making sure there is equitable distribution of resources.
What do you mean by equitable resources? Do you think that we should actually allocate facilities better?
Yes. Okay. For example, I think the the distribution of cancer treatment centers and mental health facilities. These two, I think, are good examples of where we are. The distribution is not adequate. If you're outside of the west coast, if you look at the east coast and if you look at Sabah and Sarawak, it's very, as Azrul says in his comments to The Age, he says that the shortage is extremely stark, especially in the public sector.
Correct. So Azrul also talked about staff retention as well, other than mental health problems and oncologists. So he talked about not having enough doctors in Malaysia, especially oncologists. So what are the things that we can do to attract more doctors, especially from overseas?
Yeah. Okay, that is another key aspect of the whole healthcare services, where we have been having a steady drain of outflow of doctors from the public service to the private sector, and this creates a double burden. The public health sector is short of staff, and it is being loaded with a higher and higher patient load, especially as the cost of living is going up. Then you're seeing a big transfer of people to the government hospital.
When we talked about upgrading 11 hospitals to specialist hospitals, we are talking about better distribution of medicines. So we want to also improve on health costs, that it's accessible for everybody. Is government doing enough on this?
So here again, we have to look at the health financing system that we have, and this area has been a lot of proposals have been put on the table. And I think all the stakeholders are waiting for some opportunity to engage in providing feedback on what would be the best balance between private healthcare and public healthcare, and how do you go about it. So it's another huge area.
For more on the stories, pick up a copy of The Edge Weekly at all good newsstands.